So she asked her pediatrician about that, and he was like, well, you can supplement with formula if it makes you feel better, since you can see how much he's getting. If that makes you feel better, then that's fine. And that's not what she wanted. So she left the appointment in tears and felt like her body was failing her baby. I'm Jaimie Zaki, IBCLC and Mama 5, and this is the Breastfeeding with Confidence podcast, where pregnant and new mothers learn how to prepare for and overcome breastfeeding challenges without being controlled by stress, fear, and anxiety. Each week, we'll answer your questions, share breastfeeding success stories, and inspire you to shut out the toxic whispers of the world and embrace your God-given intuition to make confident breastfeeding decisions. Let's dive in. Hey, Mama. When I was a new mom planning to breastfeed, I thought I was well prepared. And I believed that even if some challenges came up, my doctors, nurses, and that lactation consultant at the hospital would help me figure it out. What I didn't know was I would face all kinds of unexpected struggles, and the people I thought would help me didn't actually know how. After spending weeks struggling, feeling like I was missing out on bonding with my baby, and finally fighting for answers, and then going on to breastfeed all 5 of my babies for over a year each and help thousands of other moms navigate breastfeeding, I kept seeing the same problems over and over. And everyone kept saying the same thing. I wish I knew about this sooner. Why didn't anybody tell me? That's why I created the Breastfeeding Resource Library for moms who don't want to leave breastfeeding to chance. This is for moms who value breastfeeding and would move mountains to make it work. The Breastfeeding Resource Library is designed for you to go beyond just the basics of breastfeeding, but actually learn how you can avoid unnecessary formula, support a strong milk supply, and get a pain-free latch. You'll spot red flags before they become big problems. You'll have tools to fix most common breastfeeding issues, and you'll have expert support from me along the way. Don't sit around waiting for breastfeeding to miraculously work out or hoping you have, quote, good luck. Set yourself up for success now. Whether you're pregnant or breastfeeding and struggling, the Breastfeeding Resource Library is the best first step toward breastfeeding success. Visit littlebearlactation.com/library and use code podcast50 to save right now. Hello, and welcome back to the Breastfeeding with Confidence podcast. This is Jaimie. Today we are talking about low milk supply. One of the biggest worries that new moms have is whether or not their baby is getting enough milk. We're going to break down the signs of low milk supply and the ones that might be normal newborn behavior and figure out when it's time to worry and when it's just normal. If you are pregnant or breastfeeding and you want to set yourself up for breastfeeding success, you can grab my free Secrets to a First Latch Without Pain course right now. You'll also receive an exclusive offer for my low milk supply class. And since we're talking about milk supply today, I thought that would be important to mention. So you can go ahead and visit www.littlebearlactation.com/secrets to get started today. So let me tell you about my client, Alicia. Don't worry, she said that I could share this story. Alicia was a first-time mom that I worked with last year, and she was determined to exclusively breastfeed her baby. She read all the books, she took a hospital breastfeeding class, she stocked up on lactation teas and cookies just in case. On day 4 postpartum, her baby was crying constantly. She could feel her breasts filling up, but her baby just wouldn't stop crying. And somebody in her family said, "Oh, well, maybe he might be starving. He just might not have enough milk yet." And so she asked her pediatrician about that, and he was like, "Well, you can supplement with formula if it makes you feel better, since you can see how much he's getting. If that makes you feel better, then that's fine." And that's not what she wanted. So she left the appointment in tears and felt like her body was failing her baby. She was only 4 days into this and already felt like she was failing her baby. So by the time she reached out to me, she was already feeling really desperate. When we met and started working together, diving into what was going on, the symptoms she was experiencing, what made her worry, we determined that her body was making enough milk. Her baby was actually struggling to transfer it efficiently. So he was hungry, but it wasn't because she wasn't making enough milk. It was because he couldn't get the milk. Instead of just telling her to start formula, we worked to find the root cause and address the root cause. And for her, it was a shallow latch, right? Lucky for her, with a few positioning adjustments, more skin to skin, and making a few strategic changes to her feeding routine, her baby actually started getting milk. She was confident in her milk supply, and everything went really smooth after that. Alicia's story is a reminder that what looks like low milk supply can be something else. It can be normal. It could be a milk transfer issue. It might not be low milk supply. And had she not reached out and we didn't work through this, she could have ended up in that formula trap that so many moms fall into unnecessarily. Feeling afraid, making decisions out of fear, using formula out of fear, not knowing how to use it in a way that supports your breastfeeding goals, and ultimately undermining your milk supply. So if you have ever worried about milk supply, whether you are pregnant and you're worried, like, how will I know if I have a strong milk supply? Or if you're in the thick of it and you're like, I really don't know what's happening right now, let's talk about how to figure out if you have a milk supply problem. There's two kinds of low milk supply. The first is perceived low milk supply. The second is real low milk supply. And I wish there were better words for that because it sounds a little harsh, but it's really clear, and that's what it is. A lot of times we have perceived low milk supply, not real low milk supply. So we just need to determine which one you're experiencing. So, first, let's talk about what is not a sign of low milk supply in and of itself. Frequent feeding. So many moms are like, oh my goodness, my baby will not stop feeding. She has fed every hour on the hour for 3 hours straight, and I just can't catch a break. I must not have enough milk. A lot of times, this frequent feeding is actually cluster feeding, and cluster feeding is normal. Cluster feeding is basically your baby nursing a lot of times close together to tell your body to increase milk supply for a growth spurt or their upcoming additional needs, right? This happens a lot in the first few months of your baby's life. It tends to happen less as they get bigger, but it can still happen. Cluster feeding can happen when they're sick. It can happen when they just want to up your milk supply. And again, this is like proactive. Cluster feeding is a proactive way to up your milk supply. It doesn't mean you have low milk supply. Sometimes baby will be really fussy at the breast, and mom assumes that means the baby is not getting any milk. The truth is, this could be related to gas, it could be related to a flow preference, it could be related to their comfort level if they're in a position where they're having a hard time getting milk. Like in Alicia's story, the baby was having a really hard time getting milk because of the positions she was using. His head was turned and his chin was tucked, so basically down to his shoulder. He couldn't get a deep latch, and so he was working really hard to feed, but he couldn't do it. And so, of course, he got fussy. Sometimes moms will think that because their breasts are feeling softer, that they have less milk. This is actually not true. First of all, we never want our breasts to feel completely full before we feed because full breasts signal to the body to stop making milk. Empty breasts signal the body to make milk. So, in the first weeks of breastfeeding, you're going to get full, but you don't want to wait till you're full. Having soft breasts that don't feel full does not mean you are not making enough milk for your baby. After your milk supply regulates and your body kind of knows exactly what your baby needs, it's not going to make more milk. It's going to make exactly what your baby needs based off demand. So you probably won't feel like you have full breasts all the time, and that's okay. Your body is making milk based off what your baby is telling it to make. Can you imagine if you're breastfeeding for a year or 2 years and your breast felt full the entire time? Like, that would be so tough. That is not how we are designed. We are designed for breastfeeding to be natural and easy and work with our lives. I know that's not what the world tells you, but that is how we were designed. Yes, there's a transition period. Yes, there is a learning period. And no, breastfeeding does not fit well with modern society. But we were designed to make it work. And we were not designed to have rock hard, full breasts for 2 years straight. Another sign that a lot of moms think means they have a low milk supply is low pump output. So you'll have a mom who's worried about low milk supply, so she's feeding her baby, and then she decides to pump in addition to that. She doesn't get a lot of milk, and then she's like, oh crap, I must not have any milk. Well, first of all, if you are exclusively breastfeeding, anything you try to pump is additional. So you can't expect to have extra milk. We are not dairy cows bred to make extra milk. Dairy cows and dairy goats are bred a specific way over generations to make more milk than their babies need. We are not. Some of us do, and that's cool for those people if that's what they want, but not all of us do, and that's okay. Not only is low pump output not an indicator of low milk supply because you're already feeding your baby and could have given them everything they need and you just don't have extra, sometimes our pumps are not fitted properly. So if our pump is not fitted properly and we're not using it properly, we're not going to get the amount of milk we could. If you are depending on pumping and you're worried, like, I'm not making enough milk, you can visually see you're not getting enough milk to meet your baby's needs if you're exclusively pumping. Then what we need to be doing is looking at pump fit, flange fit, suction. Maybe you're using a hand pump. A hand pump's great, but it's going to be different than troubleshooting with an electric pump. It could be the pump you're using does not have great suction. There are so many variables that impact your pump output, and that does not mean you have low milk supply. I hope if any of those symptoms are the reasons that you feel concerned about your milk supply, that now you have a little more peace knowing it might not be as bad as you think it is. Now, let's talk about the symptoms that do indicate there could be a problem with your milk supply.
Hey, Mama. Sorry to interrupt, but I wanted to tell you that when I had my first baby, I really thought I was ready to breastfeed. And the truth is, I struggled, and the people I expected to help me didn't actually have the answers. That is why I created the Breastfeeding Resource Library, so you don't have to leave breastfeeding to chance. Inside, you will learn how to avoid unnecessary formula, protect your milk supply, and get a pain-free latch. You'll also learn how to fix common struggles before they become big problems. Visit littlebearlactation.com/library and use code podcast50 to save now.
All right, so the first one we're going to look at is poor weight gain. A lot of people say, like, oh, I can't tell if my baby is getting enough milk because I'm not measuring their input. You don't have to measure their input. We have quantifiable indicators of how much milk they're getting by looking at things like diaper output, weight gain. Like, there are still numbers we look at. We just look at different numbers than we've been trained to look at. So it's really just about shifting our perspective. It's not about guessing, but using our tuition, using information, and figuring it out. When we're looking for signs of low milk supply, we're looking at weight gain. Is your baby gaining weight on their curve? How much have they lost in the first week? Have they started gaining weight back yet? A lot of resources will say about a half ounce to an ounce a day is standard weight gain. That's controversial because if you put that kind of weight gain data into a growth chart, the baby would not actually continue on their growth curve. So these are averages that people looked at over a long span and then tried to break it down to a daily average. And it just becomes very misleading. And it's not as accurate as we need it to be. 7 to 10 ounces per week is a great place to be. One day your baby might gain a half ounce, the next day they might gain 2 ounces. So we don't want to get too caught up in the day to day. We want to look at overall trends, and over the course of a week, we want to see that they are staying on their growth chart, staying within their percentile. A little bit of wiggle room is not a big deal, but we start dropping a lot, we want to get on top of that. Low diaper output. This is one of the biggest indicators of milk supply problems is your baby's diaper output. During the first week of life, we want them to have one pee and one poop per day of life. More is great, but we want that one per day of life up to about day 5 or 6. By day 5 or 6, we expect to see about 6 wet diapers a day, ideally 6 poopy diapers a day too, but definitely bowel movements every single day. If we are going days without bowel movements or we have low wet diapers, we have a major problem. If your baby is gaining weight but not pooping, that's a sign that there could be a problem because if your baby was pooping the way they were supposed to, they might not be gaining weight at the same rate. So these are things that we have to look at in context with other symptoms. A tricky one is if your baby seems sleepy at the breast. A baby who is sleepy is normal. But if you feel like your baby's not getting good feeds, they take a couple sucks and then just fall asleep, they don't empty the breast, or you have to wake them up to feed on a regular basis, that could be a sign that they are not getting enough milk. If you don't hear swallowing when they're feeding, you see them sucking, but maybe you don't hear them swallowing, or you see lots of sucking, but only occasional swallowing, those are signs there might be an issue getting enough milk. And that doesn't mean it's a you issue. It doesn't mean your body's not making enough milk. It could be that they have an ineffective latch and can't get the milk to transfer. They can't get the milk out and swallow it. They can't coordinate what they need to coordinate. However, if that pattern continues, it will create a low milk supply problem because it will tell your body to make less milk, and then it will become a supply issue as well. So, what do you do if you suspect low milk supply? First, we want to make sure that we are getting a proper latch. Your latching technique, your feeding technique, your positioning is all optimized so that your baby can feed as well as possible. If we don't have that foundation laid, the rest is not going to work. Ideally, we feed on demand to ensure frequency. But if feeding on demand is going longer between feeds because your baby's not waking up, then you might need to feed your baby more frequently. Definitely offer both breasts at every feed. Avoid unnecessary supplementation. If you do need to supplement, use the SMART method, which I lay out inside of a couple of the courses I offer. I will do a podcast episode on that here in the next couple of weeks as well. But it's basically an approach to making sure that if you are using supplements for your baby, you are doing it in a way that supports breastfeeding. And you're also going to want to work with an IBCLC to really figure out the root cause of milk supply issues. And that's what we're going to talk about in the next episode because it is so important to understand the root cause of milk supply issues. We can fix the latch all day, but if your baby's actually able to transfer milk well, there could be another problem creating low milk supply. So we need to have your body and your baby's body working together. And so often, one of them is not doing what needs to be done or what it was designed to do for some reason. And sometimes it's both of them. And so we need to look at both, put it in context with each other. I hope this episode brought you some peace, brought you some answers, brought you some information so that you know exactly what to do next. You can stop making decisions out of fear and start making decisions from a place of intuition and information so that you can feel confident in your breastfeeding journey. Remember, most of the time, what feels like low milk supply can actually just be normal newborn behavior. But if you are worried, come get support. Don't wait it out. Don't just desperately throw formula at it. Don't just assume your doctor and pediatrician know what they're talking about. Work with an IBCLC to get answers for you and your baby. All right, Mama Bear, that is a wrap for today. If this episode helped you feel a little more confident or a little more prepared for breastfeeding, can I ask you a quick favor? Go ahead and leave me a review. It helps other moms find this podcast and join us in this amazing community of fierce and confident Mama Bears. And hey, if you know a friend who could use some encouragement or real talk about pregnancy, breastfeeding, and all things motherhood, share this episode with her. You've got this, Mama Bear. Trust your instincts, stay fierce, and I'll catch you in the next episode.